After my remarks, health officials will provide you with more information. As I said repeatedly, physical distancing remains one of the most important ways to protect one's health and the health of others. There are still too many people on the road going out and about. Unfortunately, some people are not taking this matter seriously. We have stepped up police enforcement, including in hotspots. I once again repeat to Family Island residents to stay at home and not to visit settlements or communities. Because there is a surge and community spread, the government decided, based on the advice of health officials, that effective 8 p.m. tonight, Friday, the 3rd of April, a complete shutdown of all services will be implemented until Monday, the 6th of April at 5 a.m. The only personnel not affected by the complete shutdown are as follows. Hospitals, that is Doctors Hospital and Princess Margaret Hospital. Hotels with guests. The Royal Bahamas Police Force. The Royal Bahamas Defense Force. OPAT operations. Security companies. And essential workers for the functioning of BPL and water and sewage corporations. Let me also note that the ferries which operate between our islands and keys are also restricted from operating during this period. At 5 a.m. on Monday, April 6, 2020, the previous 24-hour curfew, including the previous exemptions, will be back in effect. I have consulted with the leader of the opposition, who has also agreed with these necessary measures, which are designed to limit the spread of the virus and to save lives and to protect your health. I note that a number of countries have implemented such necessary restrictions. We are still in a fight to protect lives. These restrictions are absolutely necessary. I implore you to follow the advice of our health officials. The life that you protect and may save may be your own or that of your loved one, a friend, a neighbor, or a fellow Bahamian. We are in this fight together. The physical distancing measures are critical in this fight. So I say to you again, please, I implore you, I beg you, stay at home. I repeat, stay at home. If you want to live, stay at home. If you choose to die, don't take our healthcare workers with you. Don't take others with you. As I stand here, I want to live. I want you to live. I want all Bahamians to live. I want our society to continue. This virus can harm and it can kill. In the United States, 100 to 250,000 people are expected to die. This virus will not discriminate. I will provide a further update when the House of Assembly meets on Monday at 10 a.m. on the 6th of April. Then I will give you the way forward. But whatever must be done will be done. And it may be painful, but it will save lives. I will now turn over to Dr. Dal Regis, who will speak about the COVID-19 data collected so far, after which the Minister of Health and his team will provide us all with a complete update of this COVID-19 virus. Thank you very much.
Thank you. Good afternoon to you. Are we able to see how are you projecting? On what screen are you projecting? Online. I wish to show you the first graph, that is the beginning of the epidemiology curve. With epi curves, you see waves, spikes, waves. We're in our third grouping now. Next slide, please. I can, yeah. Yes. Go to the other graph, please. And this shows you what is happening with the number of cases. You see the cumulative graph points, and on the abscissa, on the x-axis, you see the number of cases. Reflected in that, you see the beginning with the dark line, the number of deaths. We've had a total of 3 deaths to date. Next slide, please. And we're looking at the rate of increase and the coefficient, the correlation coefficient, to give us guidance over time of the rate increase. Next slide, please. And here is the distribution of the cases to date. This is alarming, and the Minister of Health will further go into the presentation of the health concerns to you. Minister Sands. Thank you, Prime Minister.
Good afternoon. Thank you, Prime Minister and Dr. Dal Regis. As the Prime Minister mentioned, sadly, overnight we have had 2 COVID-19 deaths of hospitalized patients in the Bahamas. I want to begin by expressing my condolences and those of our healthcare teams to the families of the deceased. Our prayers are with you in these very difficult times. The Ministry of Health confirmed earlier today that the deaths of 2 hospitalized COVID-19 patients occurred overnight. The deceased patients included a 67-year-old female and a 79-year-old male. Investigations are being conducted into the details surrounding the cases. Contact tracing continues. To date, there are some 24 confirmed cases of COVID-19 in the Bahamas, 18 cases in New Providence, 5 in Grand Bahama, and 1 deceased from Bimini. The majority of the cases are stable, however, some are very ill. To date, a total of 281 COVID-19 RT-PCR tests have been carried out. This pandemic is serious. Dr. Dal Regis informed the country on March the 26th that we were in the surge period. The virus is here. It is spreading in our communities. COVID-19 has killed more than 55,000 people around the globe. And as there's no vaccine for this virus and no proven treatments, we have to put in place public health measures to protect you, to save lives. And our advice is summarized in 3 simple words: stay at home. I'll say it again. Stay at home. Only go out for essential items, or if you are an essential services worker, during the prescribed times by the emergency orders. Physical distancing is one of our great weapons in this fight. So when out, maintain physical distancing. Stay 3 to 6 feet apart from others. For households, it is important and wise to appoint one designated shopper. That person should go to the store alone. Do not go shopping as a family. Do not take your children to the store with you. And when you're at the store, move quickly and keep your distance from other people. Stores serving people essential items should ensure that customers are physically distant when on the lines to enter or at the checkout. We also recommend that you seek out reputable online home grocery delivery options that have risen in popularity since this crisis started. Having items delivered to your home limits exposures to others. Remember to wash your hands thoroughly, often, and not to touch your eyes, nose, or mouth unnecessarily. On the front line of this COVID-19 battle are our healthcare workers. Day and night, they care for the sick, potentially exposing themselves to the virus. In some countries with large numbers of cases, healthcare workers make up a significant percentage of those infected. Losing healthcare workers in the midst of a surge can have a catastrophic effect. Let me explain. If there are fewer trained people to administer care because they are sick, fewer people can be treated, and the quality of care diminishes. Consequently, more people die when healthcare workers catch this virus, and hospital systems become strained or they collapse. So we must protect our healthcare workers. We are doing our part by ensuring that they have the necessary personal protective equipment needed to treat patients. We have ensured that there is adequate infection prevention and control measures and personal protective equipment supplies in sufficient quantity for all those caring for suspected or confirmed cases of COVID-19 patients. The new emergency order has ended many non-urgent or emergent medical and dental services. Of the 24 confirmed cases, 5 are healthcare workers. Additionally, more than 50 healthcare workers are currently in isolation or quarantine, haven't been taken out of the system. This is a grave concern that 21% of our cases are healthcare workers. This high percentage of exposure to our health workforce cannot continue, or we will find ourselves without enough workers, without enough skilled healthcare providers to wage this war on COVID-19. I need you to do your part to protect our healthcare workers and to not overburden the system. Those who have non-emergency needs should call their medical health professionals for assistance rather than coming in. Those with COVID-19 health questions should call the hotline. The procedure for emergency calls remains the same. Call 911. We need Bahamians to only seek medical attention if it is necessary in this crisis. This is important. We need our medical professionals to be safe. We need to have them in this time of crisis because we need them to be able to help. We need to free up our doctors, nurses, and medical staff to attend to health matters. Those who need care and suspect they have COVID-19 symptoms should advise medical professionals of this before coming in so that we can prepare to assist you. All Bahamians should be proud of the men and women in our healthcare system. They are talented, dedicated, and hardworking. They are doctors and nurses, lab technicians, pharmacists, cooks, orderlies, security officers, receptionists, plumbers, janitors and engineers, emergency medical technicians, administrative staff, and communication specialists. And then there are others. There are so many people who make this system work, but all of them help to save lives. They are working hard to protect you, and I thank them, and I think that you should too. As a surgeon and as your Minister of Health, your compliance with the measures we have set will determine how well we do over the next few weeks. Don't try to find the loopholes. Don't try to sneak out. Do not go and hang out and have a drink with your friends. Do not go to visit your family or your friends. Those decisions could spread the virus, and they could make you, your friends, or your family sick. Those decisions not to comply could lead to deaths. By now, we all know about this pandemic. We all know about this virus. The questions now, however, would be, will we listen? Will we comply? Your compliance is what will defeat this virus. You staying at home, following the emergency orders, listening to public health advice, doing those things will defeat COVID-19. This is not just a crisis unfolding on TV around the world. This virus is here. It is taking and has taken Bahamian lives. I need you to listen. I need you to stay at home. I need you to comply. Thank you, and good afternoon.
The Minister will entertain your questions.
Hi there, Jasper Ward, Nassau Guardian. My first question is, so this complete shutdown that's been put into place, does this apply to healthcare workers who go into the home to assist the disabled, the elderly, cancer patients, etc.?
We will adjust our health services to ensure that no vulnerable person is left out. However, there will be significant changes to the everyday activity that takes place, not just in New Providence, but around the Commonwealth of the Bahamas.
So is that a yes? Does it applies?
There are some people who cannot get out of their homes and who require deliberate attention, and those people will continue to be cared for.
Okay, my second question is, we have 3 deaths out of 24 cases. That represents a significant percentage. Are there any concerns for how the deaths have been escalating recently? I know when we would have spoken to you about 2 days ago, we were told that there were 8 of the patients that were hospitalized and they were in stable condition. What would have changed during that time? And also to tag on to that, how many cases happened in Eastern New Providence, the hotspot?
I'll answer the first part of the question, and I'll defer to the Chief Medical Officer to answer the second part. Our understanding of the biology of SARS-CoV-2 or COVID-19 is that the virus creates significant damage, not just in the airways, but in the lung tissue itself. And the body's response with an explosion of inflammatory chemicals intended to fight the virus leads to destruction of lung tissue and a dramatic reduction in the ability to exchange oxygen and carbon dioxide. Sometimes this is progressive and intractable. And so somebody who may be stable today can get progressive shortness of breath, manifested in some instances by rapid breathing and cough, and then ultimately have no ability to get enough oxygen into their system. And that is the typical progressive deterioration that we see. I'll ask the Chief Medical Officer to address the issue of the epidemiology.
Hi, good afternoon. Certainly, I believe your question regarding the east side of the island relates to that graph that we had projected. What I think you need to understand is the east side of our island is more populated, and when we talk about east, you have to look at the landmarks that actually suggest that it's east. We have cases all across New Providence. The exact number on the eastern side, I have not actually pulled out those numbers. But I think what the graph suggested was that that side of the island, and not necessarily east, because when you think east, if you had looked at the graph closely, you may be talking about southeast and down into, a little, I think East Street was used as a marker. So I wouldn't focus on east side cases or contacts. The important thing is we have community spread, which means and we have a number of cases across New Providence, and now also in Bimini and Grand Bahama. The one case from Bimini, and we have cases in Grand Bahama. That is suggesting that we have to do the necessary measures to decrease any ongoing spread, which means those things that we're doing with the shutdown need to actually be adhered to. Okay?
Good evening, Leandro from the Tribune. So we know the lady from Bimini, she was an asthmatic. Can any health officials speak to whether these deceased cases, they had any underlying health issues?
We are still investigating the case, and we are not able to share with you her comorbidities at this time.
So my second question, in addition to the measures mentioned by the Prime Minister earlier, in what other ways are health officials tackling this virus? For example, will more tests be conducted for persons who may not display symptoms? What is the step moving forward in light of these deaths? Sorry.
Okay. Did you want me to answer that? Please. Okay. The public health approach, the measures that we have introduced, the greatest impact so far is social distancing. The messaging of public health with the preventative measures, hand washing, and now the recommendation for wearing masks outside are additional measures. In terms of the testing, tests of surveillance are quite distinct from diagnostic tests. We're testing those persons who are sick, who have symptoms, and we're following an algorithm as recommended by WHO and CDC with testing at intervals when they present and at the end of their 14-day quarantine, the sick ones and those with symptoms. The other rapid tests that you've heard a lot about are used in communities. We certainly plan to identify communities at risk in the coming period, but our focus has been on the availability of rapid tests that are validated. And these tools also give you false positives and false negatives. They are surveillance tools, not diagnostic tools, but we do intend to use community surveillance rapid testing pretty soon.
Hi, Matthew Moxie from Eyewitness News. I just wanted to ask, are all healthcare professionals wearing the appropriate PPE kits, and what is accounting for this alarmingly large number of cases amongst healthcare workers?
Do you wish to? Okay. Anyway, happy to offer a response. Healthcare workers are particularly at risk. They are exposed more than the general population. The persons coming in, they wear PPEs, but you are fully aware that there are patients who do not present with COVID symptomatology and yet are spreading the virus, have the virus. Also, our healthcare workers, they wear PPEs, and it's important that they take it off, put it on, and take it off properly. But their exposures are far greater than the non-frontline healthcare worker. But we're doing everything we can to secure the environment. And you would have heard of extreme sanitation measures that are taking place in all our healthcare facilities, and not only the public, but the private facilities.
Right. And then how many persons at the hospital are trained in facilitating ventilators? As we know, if you have to be skillful enough to use them, as Minister Dwayne Sands would have said, that it could have some repercussions.
That's a good question. And our minister has presented some research to us, and he will share that with you.
This is an oft-asked question about ventilators in the Commonwealth of the Bahamas. As of today, we have more than 70 ventilators that could be put to use. Understand that even during the COVID-19 pandemic, people still have strokes, people still have heart attacks, people still require operations. And so not all of those ventilators can be used for COVID-19 management. Using a ventilator requires that a special breathing tube is placed into the airway. There are anesthesiologists, pulmonary medicine specialists, intensivists, thoracic surgeons, general surgeons that can adeptly and expertly put that tube in, and that is perhaps the most dangerous thing for causing the COVID virus to go into the air. When you sum it all up and ask the question, how many people are trained in the Commonwealth of the Bahamas, there's probably a group of less than 100 people total. That includes those medical professionals that I just spoke of. Then you have a group of intensive care trained nurses, respiratory therapists, and others. We believe that there are more than enough ventilators in the Bahamas. We do not intend, at this point, to place ventilators in community settings where they would be more dangerous than helpful. And so, where there are intensive care beds, where there are intensive care services, in Nassau, in Grand Bahama, there we will concentrate our critical care initiatives.
Lastly, for me, with the amount of people that are trained to use those ventilators, are you satisfied with those numbers?
I am.
Okay, perfect.
Good afternoon, Altaviz Munnings from ZNS. Minister or Dr. Del Regis, first of all, I wanted to know if you can give us an update on the case of the 9-year-old female. What is her condition now, and can you tell us exactly how she was able to get the symptoms of COVID-19? And number two, do you feel as though, piggybacking on Matthew's question about an increase in cases, would it be safe to say that that increase in cases could be attributed to the persons who have been tested for COVID-19 and released or self-isolating?
Sorry, do you mind repeating that part of the question?
The second question?
Yeah. The first part, and then I'll ask you to repeat. We have Dr. Brennan from surveillance here with us.
Yes.
But the daughter, she's the daughter of one of our earlier cases that had traveled to the Dominican Republic, and she's doing well. But we're monitoring her.
Would you attribute the increase in cases to those persons who were the first case was released, and those who have cases are maybe self-isolating to an increase in the cases of COVID-19 in the Bahamas?
No, not entirely. We are looking at the linkages of each case. Indeed, the first case had a number of linkages. One of our cases had many more linkages. But what is significant is the number of contacts. And the contacts it's quite labor intensive, but we are going through all the contacts. Some have 4, they're in a small family setting. Some, the healthcare worker may have as many as 80 plus in the healthcare team, not only the healthcare environment, but also the families, the churches, wherever they have been and been in contact and put people at risk. We are following those. That's why we are appealing. Please use the distance, physical distancing, because the contacts are there. They're in the community. They're not health facility specific.
One more question dealing with the media. The Prime Minister didn't mention whether or not the media is a part of the mandatory shutdown that begins tonight. I have to work late, and ZNS is a 24-hour operation. Is the media exempted as well in the new
I
shutdown?
didn't hear the media either.
Yes, my coworkers, we really need to know, ma'am, because we have a 24-hour operation that we perform, and I'm going to be working late. I don't want to get arrested, and my coworkers don't want to get arrested. They have to work on the weekend as well. Any answer?
Please let me ask the minister, but I think you're easily recognized as essential.
Okay.
They should have their ID badges with them.
All media. If you could speak to media. Media.
So the Prime Minister would have reported or given the outline for the public just today. We will clarify, but I believe that the media are indeed considered exempt from those restrictions.
Thank you. The Prime Minister just said yes. Thank you.
Wonderful.
Okay. Good afternoon, Jerome Sawyer from RTV. My question has to do with the healthcare workers. Dr. Sanju would have indicated 21% of healthcare workers have been affected, which is significantly large.
21% of the cases are healthcare workers.
21% of the cases, sorry, which is 50 in quarantine and 5
Five of the positive cases.
Positive, okay. A lot of healthcare workers are concerned about their safety, having to work around positive patients and then have to leave and go home to their families where that contact can continue. Are there any provisions to allow for healthcare workers to stay put, stay somewhere else, be kept away from families? What is the consideration for the families of healthcare workers? In addition to that, we were notified late last evening that Doctors Hospital has gone into a complete shutdown. Are any of these cases or these large amounts tied to that shutdown, or is that facility compromised in any way to the best of your knowledge?
So I'll tackle the first part of your question. We have recognized that people have genuine concerns. In working in such a stressful scenario, sometimes people prefer not to go home, and we have provided a respite-type environment where healthcare workers can be put up, where they can rest, where they can shower, where they can sleep, and if they wish, they can stay there for as long as they want, paid for by the government of the Bahamas. To the second part of the story, with each confirmed case, we have thoroughly investigated the case to determine where the patient, the confirmed patient was, what environment they may have visited, and if there was ever a perception that there could have been contamination, we have taken the position that those facilities would be high cleaned. We have done that at Elizabeth Estates. It's now happening at Doctors Hospital, and it'll happen at the Bimini Clinic if it hasn't happened already. And so the whole idea is that we want to keep the public safe, but we also want to keep our healthcare workers safe.
Okay, so you are satisfied that Doctors Hospital has not been compromised? I mean,
well, once there are cases with a connection to a facility, then there are a number of interventions. You look at the persons involved and whether or not they are practicing appropriately, whether they are adhering to infection prevention and control measures, whether some should be put in isolation or quarantine, and then the facilities where patients would have been or cases would have been would be high cleaned to a standard defined by international regulatory bodies.
second question has to do with, I don't know if you're able to answer it, but certainly I'll put it out there. There is a video of some cruise ships off of the coast of San Salvador that is circulating that has residents there very concerned, wondering whether you were able to speak to the status of those cruise ships, who may be on board. Are they empty? Are they just out there? Do they have passengers? And also, too, what is the situation regarding quarantines in Bimini?
To the issue of cruise ships, there are a number of cruise ships devoid of passengers but with significant crew members on board. We, meaning the Ministry of Transport, the Ministry of Health, the Attorney General's Office, are in constant communication with the cruise lines. They are aware of the policies and protocols that they must follow in order to interact. Sometimes those vessels make requests for fuel. Sometimes they make requests for provisions. Sometimes they make a request to come on shore. And we go through the same types of rigorous scrutiny of the International Maritime Health Declaration to determine whether anybody on board those vessels would be ill. We take the health of the people of the Bahamas seriously, and there will be no instance where we will compromise on that.
Okay. And what is the status with quarantines in Bimini? Considering it's a small community, our first death came out of that island. Are you able to say how many people have been quarantined or what's happening on Bimini?
So we have started the investigations on the patient from Bimini who subsequently succumbed. And so as we do the contact tracing, Those persons already confirmed to have been close contacts are now quarantined. We will complete that investigation over a period of time, but at this time there are no large numbers of persons on Bimini identified as suspect cases or cases.
Thank you. You might have heard that the physician and nurses who manage the patient are in quarantine in New Providence, and the 2 transport persons are quarantined in Bimini, and we are still, as the minister said, identifying contacts, and we have only 36 to date.
This is from the Bimini case, correct?
Yes.
Okay, thank you very much.
Is that the end? Yes. Yes.
Jasper
Ms.
Ward of the
Wells?
Nassau Guardian again. All right. Hi there. So my other question is, the Bahamas, as we know, is a tourist nation. When the airport would have closed down, I presume a lot of tourists would have been stuck here. What kind of accommodations is the government making for those individuals? Are they providing them with accommodation, meals? What exactly?
I'm going to the minister.
The way this has been planned is we have given persons the option of leaving the country. So the number of tourists in country has decreased significantly. Now, it is true that there are individuals who have traveled to the Bahamas seeking safe harbor from other parts of the world, including the United States and other places. And those patients or persons provide their own accommodations or pay for their own accommodations, food, what have you. So it has not been any significant expression of a desire for assistance from the government of the Bahamas to date. I am not even aware of any requests.
I'm sorry. Good afternoon again, sir. We understand that the road traffic department closed today due to social distancing not being adhered to. Can you comment on that, and can you say whether or not social workers are also a part of the group of essential workers under the emergency order?
Again, I believe it is very important that we recognize the need to protect the vulnerable in our communities. And social workers play a critical role in assuring that the elderly, the indigent, persons who require assistance, who have great difficulty making it on their own, we will do everything that we can to ensure that they are protected, that they can eat, that their shelter is preserved. And so those individuals form a part of that essential worker corps. We have to make some changes. As you have seen over the last few days, people have continued to party. Just today, there was a huge block party that had to be broken up. People continue to have large funerals. And it's as if the message is okay for some people, but not for me. If we all take it seriously and understand the part that we play, then we will see this curve flattening. But if you look in the mirror and you don't believe that these measures apply to you, we will all pay a price for it.
Would you be able to provide some more details surrounding the protocol if a Family Island patient has to be airlifted, for example, including like timelines, or if relatives can travel with them?
Yes, we can. And we have secured all the transport isolation suits that are required. As you are aware, we are not the priority when you don't manufacture your own goods. And they pushed us to the back of the line with the order, and that compromised the transport. Transport must take place in an isolation suit for an individual who's identified as a suspect case or a known case of COVID-19. We have it, and we can publish that for you, or we can send you an email of the protocols or the algorithms that exist. There are many, because each step has a protocol.
And for those that have planned funerals for this weekend, does the new order by the Prime Minister now cancel those services?
I certainly hope so.
And then lastly, for me, for those Bahamians that are stuck away, are there any new plans to return them home?
Not to my knowledge at this time, but Minister?
I believe the Prime Minister was very clear. He was very direct. He was very sincere. These are not ordinary times. And we can therefore not apply ordinary measures. There will be significant changes in the day-to-day normal activity of all Bahamians, all visitors. And so this weekend should be a very, very quiet time in the Commonwealth of the Bahamas. We encourage people to spend time with each other, talk to each other, play games, have a discussion. You may get to know your family a little bit better. And we hope that as we go through Saturday and Sunday until we meet in the Honorable House of Assembly on Monday, that we see not only a peaceful, quiet time, but we see less and less transmission of this horrible, aggressive virus.
Distinguished members of the press, we would not see that graph traveling in that direction if we were all doing what we were asked to do. A special appeal. Everyone has to participate. Please assist. We can do this. We've been through many challenges. We've met those challenges. We can meet this. And if we all participate with the social distancing, we will return to normalcy in a quicker time, in a shorter period of time. I want to thank you all for all the good work that you're doing in getting the messages out. I think what I'm asking you now is to really implement those messages whenever you see there's a need to. Thank you again.